Now, the Centers for Disease Control will be lifting its requirement for travelers to test negative for COVID-19 before entering the U.S.
So thrilled about that. So exciting. I just wish that it was like last weekend, but
I'm over COVID. I'm ready to kind of get back to traveling and have that freedom again.
The change comes into effect tomorrow. Officials say they're dropping the requirement due to the, quote, tremendous progress the country has made in the fight against the virus. The CDC says it will reevaluate the policy in 90 days and will not hesitate to reinstate the rule if necessary. For more, let's go to Dr. Aileen Marty, infectious diseases professor and outbreak response expert. Always a pleasure to have you on the program, Dr. Marty.
Thank you. It's always a pleasure to be here. Let's talk a little bit about, there's some differences between what's going on in the U.S. or what's going to start at midnight tonight versus your random testing. This has been a very strict way to reduce the possibility of there being people who are shedding virus on an airplane. Now, people will wittingly and unwittingly be carrying the virus onto the aircraft. That is going to happen. The amount of virus still circulating in communities. Here, for example, in South Florida, we're at 22% positivity. That means 1 out of every 4 or 5 person, because that's only the known positivity rate. 1 out of every 4 to 5 persons is positive. So the odds that you're going to be on an aircraft with people who are positive has gone up, will go up with the lifting of this, which means that individuals, it behooves each individual now to take the types of precautions they need to take to reduce their risk while flying.
So what does that look like then, doctor?
What that looks like is, especially if you are vulnerable, if you are an individual who is immunocompromised, with or without boosters, you should not get on that airplane unless you're wearing a mask and wearing it properly the entire time. Also, put on that nice air that's coming around to create a nice air shield around you, because what we're seeing now in many parts of the United States, and certainly here in South Florida, is not only a growing number of people who have it and people who have been infected and reinfected again, but also, and by the way, with long COVID possibilities in quite a few people, with also the realistic increase. We've had a 6-fold increase in hospitalizations. And those individuals who are hospitalized, 76% are unvaccinated, once again. And then among the people who are vaccinated and ending up in the hospital, it is those vulnerable individuals. So while this is great for the travel industry and will help the economy, and of course will make traveling easier for all of us, it's also going to impose an increased risk, and it's almost inevitable that cases will rise.
I did want to quickly shift focus here to the monkeypox virus. There are so far 45 confirmed cases in the U.S. Canada, we have 112. What's your country's approach to containing the spread of the virus?
We're doing the same as you are. We're trying to identify every single case and then do ring vaccination around those individuals that are positive, which is the way that we controlled smallpox in the past. This monkeypox virus is a virus that has this year caused in Africa 77 deaths already. The numbers have risen in a spectacular way and is multinational in such a way that we know that there is community transmission in multiple countries right now. We have identified individuals with monkeypox that have not traveled and are not connected to any other person that we know of that has monkeypox, which means that there is also subclinical transmission. Now, overall, it's mainly in men having sex with men. However, we're also seeing it in women, and there is a realistic possibility that it will expand significantly beyond the MSM population, particularly since we also have documented cases of people acquiring monkeypox from fomites, fomites being things like towels and bed sheets that have been contaminated from someone that has monkeypox.
And Doctor, very quickly here, only a few seconds, but the U.S. has ordered about 500,000 doses of the vaccine to combat infection against monkeypox. Are you concerned with the divisiveness around vaccines as a topic, as an issue in North America, that there could be a lack of uptake?
There is very many important things that need to be known about the vaccines. There are several different levels of vaccines that exist that were developed originally for smallpox but work very well against monkeypox. There are first, second, third, and fourth generation vaccines. What the U.S. has in its stockpile, the main bulk is a purified form of second generation vaccine, the ACAM 2000, but we're acquiring more and more of the much safer, much better third generation vaccine that you also have in Canada and is also available in Europe. There's a different third generation vaccine available in Japan. Those third generation vaccines are very safe. They cannot replicate in human cells, and therefore they're even safe to give to immunocompromised individuals and pregnant people. That's very different from the second generation vaccine, which is the most common vaccine, which is the type of vaccine that an older individual like myself received years and years ago.
Okay, we do have to leave it there for the interest of time, but we always thank you for yours, Dr. Aileen Marty. A pleasure.